Okay, so we did neurology. The history of neurology dates back to the Incan tribes of South America, like ancient Greece, China, and Egypt. The modern practice of neurology began around 1950, around World War One, World War Two, which led to the treatments of like Parkinson's and epilepsy.
The educational requirements of a neurologist are that you have to be a doctor of medicine. You have to do a clinical residency. Most people also do a fellowship in a specialized area. Like if you want to be a neurosurgeon, you have to do that. And then to get into medical school, you have to take the MCAT written exam, and it costs around $310.
The work setting for a neurologist, they normally are self-employed, working in their own practices. They work in well-lit examination rooms, normally around 60-plus hours a week. Unless they are working in like a hospital, then they work around like 80 hours a week.
The roles and responsibilities of a neurologist are to diagnose and treat the patient, which can, have things to do with tumors in the brain or in the spinal cord, epilepsy or neurological conditions like that, multiple sclerosis, traumatic injuries of the brain, and sleeping disorders. There's also a lot more, but you can't really list all of them.
The starting average salary is around 180K. Malpractice insurance rates can be as high as $300,000. If it's solo practice, then the doctor would have to pay for the malpractice out of pocket. If the doctor is in a group or a private practice, then his employer would assist with insurance premiums.